mental health is, but what is behavioral health? How is that different?
In the industry, we use the term behavioral health to encompass both mental health and substance use disorders. So mental health includes conditions like depression, anxiety, also psychosis. Substance use, we usually use the name of the substance in the title, so we talk about things like opioid use disorders or alcohol use disorders. But the term behavioral health is really an umbrella term to encompass both mental health and substance.
Why is this such an important topic in healthcare today?
Often it's individuals with behavioral health disorders that have the worst health and are driving the highest medical expenses in a population. And what we know is that if that population gets effective treatment, especially effective treatment in the outpatient setting, what we will see is an improvement in total health and a reduction in spend. So we have to have a really strong behavioral health strategy. We've got to have a really strong behavioral health network to meet the needs of individuals with behavioral health disorders to really drive value for our system overall.
So what are we doing at Blue Cross and C to address the behavioral health of our members?
Our strategy for behavioral health at Blue Cross has three major components, all driven towards improving access to effective treatment for our members. The first component is integrating behavioral health treatment within primary care. That does several things. One, it improves access. Two, it helps primary care providers address the whole health of our members, so not only the physical health issues, but also their behavioral health conditions. And three, it can reduce stigma because people feel comfortable with their primary care provider and don't necessarily have to go across town to a separate provider that focuses on behavioral health. For people with more severe mental health and substance use disorders, we're going to increase access to effective behavioral health specialists. So we're going to recruit within our state and nationally high-performing behavioral health providers. We're going to hold them accountable for access to make sure that our members can access these providers. We're also going to measure quality to make sure that the treatment being delivered is effective. The third component is what we're calling the BestinClass Solutions. This is an area where we're really trying to think outside the box. How can we really rethink how behavioral health services are delivered, making them more effective and more convenient so that people can access treatment in the way that they want. So we're thinking about things like telehealth, digital and online cognitive behavioral therapy, and a completely different way of approaching substance use outpatient and residential treatment center treatment to make sure that our members can access effective care.